Hi, Jill Horowitz here. I'm very excited to introduce you today to Greg Fields. Greg is a Broward College alum that has gone on and gotten his PhD. He's a professor, and he is basically helping all of human life with the amazing research and the talent that he has working at the Institute for Human Health and Disease Intervention, also known as iHealth at FAU. So without further ado, I'm going to let Greg tell us all about what you do, and then you can go into how Broward College helped you get your start. So tell us what you do, Greg.
Right, so I serve as executive director of, as you mentioned, iHealth. So the Institute for Human Health and Disease Intervention was founded to look at very specific areas within human health and really think about how you could take basic research and develop that along the lines of with clinicians so that you can help patients. Now, in the case of iHealth, we focused on three areas. One is cancer, one is infectious diseases, and one is human health and dementia. So in each of those cases, we have programs where we're working basic researchers at FAU along with Scripps, Florida, and in some cases, some people even from the Max Planck Institute with various clinical outlets. We have an affiliation with Memorial Healthcare Systems, and we also work with other local clinicians up in the Palm Beach area where FAU is located, and also even going up into Martin and Port St. Lucie counties where we have Cleveland Clinic.
Wow. So why don't you tell us where you went to high school, and then we know what you did and how Broward helped you get your jump start for having your BS in chemistry from UF, your PhD from FSU, and then the postdoctoral studies from UC. So go ahead and tell us, starting with Broward in high school, how you got your start.
Yeah, so I'm extremely grateful for the opportunity at what was then Broward Community College. I went to Piper High School, and at the time, they didn't really have programs sort of divided up as far as certain types of classwork, but what they offered was an early admissions to college program. So you could leave high school in your junior year and then go to one of the community colleges. And that's what I opted to do. So I went to Broward Community College. I was on both the central and northern campus in eventually obtaining my AA degree in chemistry. Worked out very well. First of all, I thought the faculty was very talented. The background that I received was quite strong, worked extremely well when I went on to other educational institutions. But it also had enough flexibility where I could work at the time because I worked full time during my college years. So after getting my AA in chemistry at Broward, I went on to University of Florida, and that's where I received my bachelor of science degree in chemistry. And as I mentioned, the background that I received at Broward supported me very well going to University of Florida. Clearly the people there at Broward were very talented and very good instructors. So after going to University of Florida, I had met one of the faculty members there and became very interested in doing research. So that convinced me to go on to get my PhD, which I did at Florida State. So I'm actually an alum of three different institutions from the state of Florida. But then after leaving, after getting my PhD, which was in chemistry and biochemistry, I felt I needed a little bit more of a clinical background to be able to apply the types of chemistry research I had done in my graduate years. So that's why I went to University of California, San Francisco, where I was in the Department of Pharmaceutical Chemistry there. And that really gave me a good indoctrination to the medical field, to how you apply basic research in a clinical setting. And after that point in time, my own career has been one where I've been primarily involved from how to apply basic research into treatments, into patient care, so on. After finishing my postdoc, I did my assistant and associate professor years at University of Minnesota. Great institution, very cold. Came back to Florida, was at FAU for about a decade in Boca, then at University of Texas Health Science Center in San Antonio, a place that I thought was quite a great place. But then for various reasons, I was enticed to come back to Florida, and now I'm back at FAU primarily on the Jupiter campus with the Institute.
Wow. So I understand we are so lucky to have you here in Florida. Why don't you tell us about this new award, the Cancer Center of Excellence Award that you've been given and that you're working on?
So as I mentioned, one of the research focus areas within iHealth is cancer. So what we looked at is the environment here and again, how different researchers could work with each other to really improve cancer care. And we came up with a really excellent group. Down at Memorial Healthcare Systems, they have the Memorial Cancer Institute, which is a clinic that really sees quite a number of oncology patients every year. We have the basic research component here at FAU and also at Scripps, Florida. And we have Gift of Life, who deals primarily with blood cancers and trying to find matches really across the country and internationally. So we put this group together and applied to the Florida Department of Health for what's called a Cancer Center of Excellence designation. The state has 4 of these. One is down at the Sylvester Cancer Center in Miami. You have the Moffitt Cancer Center in Tampa, Shands up in Gainesville, and Mayo in Jacksonville. So we were applying to be the 5th of these Cancer Centers of Excellence, and we found out about a month ago that our application was successful. So hopefully we'll hear about more of this from the Florida Department of Health, but we were very pleased to get this designation. But what it really means is that it shows you're really advancing cancer research in a direction in consideration of how you're going to improve patient care a number of different ways. And it also helps, we'll potentially receive additional support from the state as we develop unique approaches, unique treatment strategies, and really expand on what we've already started to do.
And I bet if you added it up, you've saved many, many, many lives and are about to save many, many more. I think cancer, of course, has touched everyone in their families. So why don't you say if there is a certain kind of quote, a favorite quote that you might have that we would want to all know about that inspires you here?
So one of my favorite quotes is actually one from John Lennon from the song Beautiful Boy. And the quote is, "Life is what happens to you when you're busy making other plans." And, when I talk about my career, talking about it nowadays, it sounds very linear. And the reality is, it wasn't. Different opportunities came up for very different reasons. I'll give just one brief example. I mentioned about my initial faculty appointment at University of Minnesota. Not an institution I ever thought about. When I was at University of California, I attended a meeting, did a presentation there. Someone came up to me, said, "Oh, we might have some opportunities at Minnesota. Might you be interested in this area?" It turned out to be a great match, and really, very successful early stage in my career. And that was not due to any plan whatsoever. It was just due to I ran into somebody, we had common interests, and it worked out.
Wow. So we have to ask you, being in your position, where do you see for the health and disease intervention, et cetera? Do you think this pandemic will be gone? Do you think we're going to come out of it no more masks, or is this something for the next 5 years? What is your thoughts on that?
Well, they've talked about how this particular coronavirus will probably be with us forever. The reality is, because it also is transmissible to animals, that tends to keep diseases around. But, we are certainly going to reach a point where there's going to be enough herd immunity. Most likely the severity of the virus will decrease so that it's just going to be something we will live with. We're going to be wearing masks for a while longer, no question about that. And then we'll see, what form the virus exists in a year from now. There will be, we're slowly returning to what we would consider a more normal life. But I think what's also going to be important about this is we become aware of these types of potential hazards that can pop up in the future. If you talk to scientists, their biggest concern going forward, they're going to tell you, are certain infectious diseases. And hopefully this makes, the world more aware of this as a potential problem so we can be better prepared as these things come up in the future.
Well, we are so lucky that you went from Piper to Broward College. Is there any particular professor or something that stood out that turned you on to chemistry, or how would you?
So, yeah, this was actually, you say professor, but really was a high school teacher. I had a high school teacher, Helen McConnell, who was a great chemistry teacher, and that really sort of propelled me on. I wish I could remember the different people I interacted with over the years. I'm sorry to say it's been a long time, but certainly, I had some just very good people who were inspirational, in not just keeping me in chemistry, but sort of building that interest in it.
Right, and we're very lucky that you saw the pharmaceutical aspect that is helping humankind. So thank you very much. Encourage you to look on LinkedIn. Gregg has won numerous awards and done numerous publications, and we're just so thrilled to have you in South Florida. So thank you again, Dr. Fields, and we'll look forward to connecting again soon. Thank you.
Okay, thank you very much. Appreciate it.